More and more COVID deaths in Iran. Official statistics say more than 100,000 have died. There's a shortage of everything, especially jabs. Iranian researchers have developed their own vaccine, but production is nowhere near meeting demand. US and British vaccines had been rejected for political reasons. Meanwhile, the infection rate is surging. Only the USA and India have higher rates. This is your COVID-19 special on DW. I'm Janelle Dumalaon. It's not just a rising infection rate and a slow vaccination rollout creating an uphill battle for Iran. There's another problem as well, a shortage of many treatments and even basics such as oxygen tanks that are critical for keeping COVID-19 patients alive.
Hassan Ahmadi is looking for liquid gold. That's what some Iranians call what's inside these bottles, oxygen. Ahmadi scars factories across Tehran so he can supply hospitals with oxygen.
Unfortunately, there are more and more people infected with the coronavirus who need oxygen, but there simply isn't enough to go around, and demand is increasing every day.
This company has a small stock. More and more often, Ahmadi is contacted by people who are seriously ill with COVID-19. The hospitals don't have room for them. But often, Ahmadi simply can't help.
If I have to tell a sick person that we don't have enough oxygen, they panic, which of course is terrible for somebody who is ill.
Hassan Ahmadi hopes there will be enough oxygen for everyone today. The infection rate in Iran has remained very high, with tens of thousands of new cases and hundreds of deaths each day. Only about 10% of the population are fully vaccinated. The government says that's because of import restrictions due to US sanctions. But some Iranians also see it as the government's failure. Initially, they refused to import Western vaccines. Adding to the desperation, many medicines are also in short supply. Long queues outside pharmacies are a frequent sight in Tehran as people attempt to find medications for relatives sick with COVID-19.
I need to find medication for a relative. The hospital he's in doesn't have what he needs. I've been looking for it since 6 in the morning. Those responsible should really take care of us once and for all. So many people are dying every day. They need to help us.
Ahmadi arrives at the home of a sick person, where he delivers a bottle of oxygen. Unfortunately, today he doesn't have enough for another family that's also in need.
I want to help everyone, but often I feel so powerless. It's a real mystery to me how those people who can help and don't live with it.
Hassan Ahmadi takes an empty bottle with him, but he doesn't know if or when he'll be able to fill it up with oxygen again.
Alex Vachanka is the director of the Iran program at the Middle East Institute. He joins us from Washington, D.C. Welcome to the program. We're talking about a health emergency, an economy plagued by sanctions, and a crisis of public confidence in the government. What more can you tell us about the roots of this current public health crisis in Iran?
You know, it's a crisis on multiple levels. One, on the one set of problems that, Ibrahim Raisi, the new president, has dealt with is the issue of public trust. Iranian public simply don't trust that their government is doing everything it can to deal with the crisis. That's number one. I don't know how Ibrahim Raisi is going to be able to do things differently than his predecessor, Hassan Rouhani, since this crisis now is almost 2 years old. But there you have it. Ibrahim Raisi has to try something different. And the obvious one he can do is to end quickly as possible Iran's international isolation. He needs to make compromises on the nuclear talks. He needs to talk to the likes of the United States, countries that have offered vaccines in the past. And for political reasons, Tehran decided that it wasn't willing to take, for example, American and British vaccines. So these are political decisions. It will take time, as the rest of the world is discovering. It will take time to deal with this health crisis. But in the case of Iran, there are certain political decisions that can be made in Tehran that will help move things forward.
Can you tell us more about why the political leaders in Iran turned down Western vaccines?
Well, as I said, this was a political decision. Ayatollah Khamenei simply said there wasn't enough trust that the Americans and the British might be up to some mischief. I couldn't trust. I'm quoting Khamenei himself. He said, if they're good at making vaccines, why don't they make it for themselves? Why did they send it to us? The message basically was that they might, tamper with the vaccine in some way or another, try to hurt the health of the Iranian public. So again, it was a pure political decision on Khamenei's part. There was no scientific or any other kind of data to back up that position. And in fact, he has had to walk it back since then.
Now, is it fair to say that the Iranian government's mismanagement of the pandemic is mostly to blame?
I think a good part of the responsibility has to go with the political leaders of the country. I mean, yes, the sanctions were there. Iran is isolated in terms of its ability, for example, to pay for things like vaccines. I mean, if you don't have access to a banking system, and Iran does not, then it's hard to pay for some of these imports. So surely, yes, the sanctions regime has made life more difficult. But then you have these political decisions like the one by Ayatollah Khamenei, where he comes out and says, we're not trusting the Americans or the British. We will make our own vaccine. And they've been working on this vaccine for some time now. It's not been produced fast enough. And so again, yes, the process to deal with the vaccine, with the COVID crisis, no doubt has had the problem of being slowed because of political decisions made by leaders in Tehran.
Speaking of political decisions, the new president is under fire even among his supporters for refusing to lock down the country for 2 weeks at the request of the Ministry of Health and because of the shortage of vaccines. What's the outlook there?
President Ibrahim Raisi is somebody who got the presidency on a silver platter. He does not have much support at all. I mean, this presidency was engineered for him. Now he's in the presidential palace. He has to prove himself. He has to prove his credentials. And clearly what he's aiming to do is to deal with some of the crises that are imminently hitting the country. One is the vaccine issue. I don't think Ibrahim Raisi has any quick solutions, but he's also out there trying to, for example, restart the nuclear talks. There's hope that Iran could have some of the frozen Iranian monies around the world, sent back to Iran if there is some kind of a nuclear deal. So the hope is that Ibrahim Raisi can do something different and better than his predecessor, Hassan Rouhani, to, one, deal with the public anger. But Raisi has also a long-term ambition of giving himself, if you will, a good name and create some sort of a positive light around himself. But it's not going to be easy. He's got multiple challenges to deal with. But now he's in the presidential palace, and he has no alternative but to try it.
A complex set of factors there in Iran. Alex Vachanka is the director of the Iran program at the Middle East Institute. Thank you so much for your analysis today.
Thank you.
And now we come to that part of the show dedicated to your questions. Here's our correspondent, Derek Williams.
Mask mandates are divisive in some places. Do they work or not? What does the science say?
Few mitigation measures have been as divisive during this pandemic as masks. If you remember back to those dark days of fear in early 2020 when borders were closing and country after country slammed into lockdown, the topic of masking up and whether people should be doing it, and if so, who exactly should be wearing them, it was a mess. And after 1.5 years of often contradictory messages and policy reversals among healthcare authorities, the topic has become hopelessly politicized in a lot of places. So what does the evidence say? Well, I think that we're at a point now where pretty much all experts worth the name agree that masks help limit COVID-19 transmission. And to be honest, come on, with a respiratory disease that's transmitted via droplets and aerosols exhaled by the infected, that shouldn't come as a surprise. It's been a lot harder, though, to pin down exactly how much masks help. But now a new, really massive randomized study, which is still going through peer review, I should mention, it appears to have provided some more clarity. The researchers tracked symptoms and antibody levels in around 340,000 Bangladeshis in rural parts of that country, providing different types of masks to one group and encouraging their use, while no interventions were made in the other group. The study was pretty complex, and it produced a lot of really interesting results that I don't have time to mention here. But one key one was that the authors said that surgical masks, in particular, clearly helped to prevent the development of disease in villagers that got them and were encouraged to use them. Rates of infection among those villagers were around 10% lower than in villages in the control group, where masks were worn much less. Now, that might not sound like much, but it's pretty significant. And the authors also add that 10% is a lowball number, and they expect that mandated universal masking would almost certainly drive transmission down a lot more.
And before we let you go, some vaccine news. Cuba has become the first country in the world to vaccinate children from the age of 2 against COVID-19 using homegrown jabs not recognized by the World Health Organization. The communist island of 11 million people aims to inoculate all its children before reopening schools that have been mostly closed since March 2020.